Anxiety is a prevalent mental health condition that affects millions of individuals worldwide. It can manifest in various forms, from generalized anxiety disorder to social anxiety, panic attacks, and phobias. The impact of anxiety can be far-reaching, disrupting daily life, impairing productivity, and negatively affecting overall well-being. For those struggling with anxiety, finding effective and safe treatment options is a top priority. One medication that has gained attention for its potential benefits in managing anxiety is gabapentin. In this comprehensive guide, we will explore the ins and outs of gabapentin, its mechanism of action, and the research surrounding its use for anxiety relief. What is gabapentin and how does it work? Gabapentin, also known by its brand name Neurontin, is a medication primarily used to treat certain types of nerve pain, seizures, and in some cases, anxiety disorders. It was initially developed as an anticonvulsant drug, but its versatility has led to its off-label use for a variety of conditions, including anxiety. The exact mechanism by which gabapentin exerts its anxiolytic, anxiety-reducing, effects is not fully understood. However, researchers believe that it works by modulating the activity of certain neurotransmitters in the brain, such as gamma-aminobutyric acid, GABA, and glutamate. By altering the balance of these neurotransmitters, gabapentin may help to reduce the physiological and psychological symptoms associated with anxiety. The potential benefits of gabapentin for anxiety relief. Gabapentin has been studied extensively for its potential benefits in managing various anxiety disorders. Here are some of the key ways in which gabapentin may help alleviate anxiety. Reduction in anxiety symptoms. Numerous studies have shown that gabapentin can effectively reduce the severity of anxiety symptoms, including feelings of worry, fear, and tension, as well as physical manifestations such as muscle tension, increased heart rate, and sweating. Improvement in sleep quality. Anxiety can often disrupt sleep patterns, leading to insomnia and poor sleep quality. Gabapentin has been found to improve sleep quality and duration, which can have a positive impact on overall anxiety management. Enhanced cognitive function. Anxiety can impair cognitive abilities, such as concentration, decision-making, and memory. Gabapentin has been associated with improvements in cognitive function, which can be particularly beneficial for individuals struggling with anxiety-related cognitive impairments. Potential for addiction management. Gabapentin has been explored as a potential treatment option for individuals struggling with substance abuse or addiction, as it may help to reduce cravings and withdrawal symptoms, which can be closely linked to anxiety. Versatility in anxiety disorder treatment. While gabapentin is primarily used for the treatment of generalized anxiety disorder, it has also shown promise in managing other types of anxiety disorders, such as social anxiety, panic disorder, and post-traumatic stress disorder, PTSD. Research and studies on gabapentin for anxiety. The potential benefits of gabapentin for anxiety relief have been the subject of numerous research studies and clinical trials. Here's a summary of some of the key findings. A 2011 systematic review and meta-analysis. This study, published in the Journal of Clinical Psychiatry, reviewed 8 randomized controlled trials involving a total of 1,233 participants. The findings suggested that gabapentin was significantly more effective than placebo in reducing anxiety symptoms, with a moderate to large effect size. A 2016 study on gabapentin for social anxiety disorder. This study, published in the Journal of Clinical Psychopharmacology, examined the efficacy of gabapentin in treating social anxiety disorder. The results indicated that gabapentin was associated with a significant reduction in social anxiety symptoms compared to placebo. A 2018 study on gabapentin for generalized anxiety disorder. This study, published in the Journal of Clinical Psychopharmacology, investigated the use of gabapentin in the treatment of generalized anxiety disorder. The findings showed that gabapentin was more effective than placebo in reducing anxiety symptoms and improving overall functioning. A 2019 study on gabapentin for PTSD-related anxiety. This study, published in the Journal of Clinical Psychiatry, explored the use of gabapentin in managing anxiety symptoms associated with post-traumatic stress disorder, PTSD. The results indicated that gabapentin was effective in reducing PTSD-related anxiety and improving overall quality of life. These studies, along with numerous others, suggest that gabapentin may be a promising treatment option for individuals struggling with various forms of anxiety disorders. However, it's important to note that the research is ongoing, and individual responses to gabapentin may vary. Dosage recommendations and precautions. When it comes to using gabapentin for anxiety relief, it's crucial to follow the dosage recommendations and precautions provided by healthcare professionals. The appropriate dosage of gabapentin can vary depending on the individual's age, weight, and the severity of their anxiety symptoms. Generally, the starting dose of gabapentin for anxiety is typically 300 mg per day, taken in divided doses, e.g., 100 mg 3 times a day. The dosage may be gradually increased over time, as tolerated, up to a maximum of 3,600 mg per day. It's important to note that the dosage should be adjusted under the guidance of a healthcare provider, as individual responses may differ. Precautions to consider when taking gabapentin for anxiety include potential interactions with other medications. Gabapentin may interact with certain drugs, such as opioids, antidepressants, and anticonvulsants. It's essential to inform your healthcare provider about all the medications you are currently taking. Increased risk of suicidal thoughts or behaviors. In some cases, gabapentin has been associated with an increased risk of suicidal thoughts or behaviors, particularly in the first few months of treatment. Patients should be closely monitored for any changes in mood or behavior. Withdrawal symptoms. Abruptly stopping gabapentin can lead to withdrawal symptoms, such as anxiety, insomnia, and even seizures. It's crucial to work closely with a healthcare provider when discontinuing or adjusting the dosage of gabapentin. Potential side effects of gabapentin for anxiety. As with any medication, the use of gabapentin for anxiety may be associated with potential side effects. Some of the most commonly reported side effects include drowsiness and fatigue, dizziness and balance issues, blurred vision, dry mouth, constipation, swelling in the hands and feet, mild cognitive impairment, such as difficulty with memory or concentration. It's important to note that not everyone will experience these side effects, and the severity can vary from person to person. If you experience any adverse reactions or have concerns about the side effects of gabapentin, it's essential to consult with your healthcare provider. Alternatives to gabapentin for anxiety relief. While gabapentin may be a viable option for some individuals, it's not the only treatment available for anxiety. Here are some alternative approaches that may be worth considering. Psychotherapy. Cognitive behavioral therapy, CBT, and other forms of psychotherapy have been proven effective in managing anxiety disorders by addressing the underlying thoughts, behaviors, and coping mechanisms. Herbal and dietary supplements. Supplements like chamomile, lavender, and valerian root have been studied for their potential anxiolytic effects. However, it's crucial to consult with a healthcare provider before starting any new supplement regimen. Relaxation techniques. Practices such as deep breathing, meditation, yoga, and mindfulness can help reduce anxiety symptoms and promote overall well-being. Lifestyle changes. Adjustments to diet, exercise, and sleep habits can have a positive impact on anxiety levels. Other medications. Depending on the specific anxiety disorder and individual circumstances, healthcare providers may prescribe alternative medications, such as selective serotonin reuptake inhibitors, SSRIs, benzodiazepines, or beta blockers. Consulting with a healthcare professional navigating the complexities of anxiety and exploring treatment options can be a daunting task. It's essential to work closely with a healthcare professional, such as a psychiatrist, psychologist, or primary care physician, to determine the most appropriate course of action. During your consultation, be prepared to discuss your medical history, current symptoms, and any previous treatments or therapies you have tried. Your healthcare provider will be able to assess your individual needs, provide personalized recommendations, and monitor your progress throughout the treatment process. Personal experiences and testimonials. While research and clinical studies provide valuable insights, hearing from individuals who have first-hand experience with gabapentin for anxiety can also be informative. Here are a few personal testimonials. I've struggled with generalized anxiety disorder for years, and nothing seemed to work until I started taking gabapentin. It's been a game changer for me. My anxiety symptoms have significantly improved, and I feel more in control of my emotions. The side effects were minimal, and I'm grateful to have found a medication that works so well for me. As someone who has dealt with social anxiety for most of my life, I was hesitant to try gabapentin. But after discussing it with my doctor, I decided to give it a shot. I'm so glad I did. The difference in my confidence and ability to navigate social situations has been remarkable. It's not a magic cure, but it's certainly made a noticeable difference in my quality of life. I've been using gabapentin to manage my PTSD-related anxiety, and it's been a lifesaver. The reduction in my anxiety symptoms has allowed me to engage in therapy and other coping strategies more effectively. I still have my ups and downs, but gabapentin has been an invaluable tool in my journey to better mental health. These personal accounts highlight the potential benefits of gabapentin for various forms of anxiety, as well as the importance of working closely with healthcare professionals to find the right treatment approach. Conclusion: is gabapentin a viable option for anxiety relief? Based on the research, studies, and personal experiences explored in this comprehensive guide, gabapentin appears to be a promising option for individuals seeking anxiety relief. While it may not be the right fit for everyone, the evidence suggests that gabapentin can effectively reduce the severity of anxiety symptoms, improve sleep quality, and enhance cognitive function in many cases. If you're struggling with anxiety and are interested in exploring gabapentin as a potential treatment option, I encourage you to schedule a consultation with a healthcare professional. They can provide personalized guidance, assess your individual needs, and help you determine if gabapentin is the right choice for you. Remember, your well-being and mental health are of the utmost importance, so don't hesitate to seek the support and care you deserve.